The Southward Promise neighborhood, we provide a coordinated pipeline of services and resources that guides and supports families so that children can live in healthy homes, succeed in school, and contribute to their communities and thrive in life.
As a result of COVID, we have had to shift just about all of our programming. When the world shut down in March of 2020, we came together and knew that we needed to put a call to action out to our partners, out to our funders, out to the community about the urgent needs that our families were facing. And some of that included food, baby supplies, diapers, formula, wipes. And once we were able to get that message out to our people, to our network, it was a matter of trying to figure out how we were going to get these supplies to them. So we launched a tech support hotline, and it allowed the Clinton Hill community, the South Ward of Newark community, to be able to reach out through this text line and let us know what their needs were. So some of those needs that came out of those calls, of course, were, food and baby supplies. We were already taking care of that. Financial assistance, emergency resources and cash assistance. People were sent home. People weren't allowed to go back to work unless they were deemed essential. So we started to provide emergency cash assistance. And this was before that very first stimulus became a thing. People had no idea how they were going to pay their rent, how they were going to keep their lights on, how they were going to keep their cable on. Kids were shifted to remote learning. So we also started to bridge that digital divide by trying to ensure that the students in our schools had the computers that they needed. But like the entire world, Chromebooks were on back order, as well as trying to provide our families with hotspots. In addition, we all know that COVID took many lives, and so our one-to-one virtual support services with our partner Imagine Center for Grief was heightened. So you could call in for any of those supports. Oh, and we also offered just one-to-one virtual support with a master level social worker to ensure that families had the supportive solutions and tools to navigate this uncertain time. So with this became like our COVID response hotline. So I definitely think because of COVID, we know that children's health, parents' health, health in general, it has to be more of a priority. We knew this going into the work that we were currently doing before COVID, but even more so now because of COVID, we realize how super important and vital it is that families have a medical home that they can take their children to for wellness checkups, for checkups for themselves, to get the vital medicines or dental appointments, instead of always having to rely on the hospital.
We've worked really, as Jasmine mentioned, in collaboration with a lot of different partners, and to get through a lot of what we've gone through with COVID is to rely on our partnership to leverage and scale up the work that we're doing to support families, children and families, and so continue to collaborate across with various organizations to ensure that students and families and children are receiving as much support as they need.